I'm Dr. Carolyn Getman. I'm a neonatologist here at Mercy San Juan Medical Center, which means I specialize in taking care of babies. So today on Ask the Expert, we're going to talk about all things NICU. Question 1. If my baby is admitted to the NICU, am I able to bond with my baby? So a lot of parents are concerned when their baby's admitted to the NICU that maybe I can't bond with my baby. And that's absolutely not true. You can. And the ways that we can help you do that, one is that if your baby is a little bit unstable early on and can't tolerate being held, the nurses will help you do hand hugs and positive touch for your baby. Once your baby's more stable, we'll have you start doing what we call kangaroo care or skin-to-skin care. We also encourage parents to room in whenever possible. We're actually the only NICU in town where every baby can have one parent room in from start to finish. Question 2. If my baby is born prematurely, will my baby have developmental delays? We know that when parents have a premature baby, they worry automatically that their baby's going to have a developmental delay, and that's not necessarily true. What we do know is that parents can make a huge difference in their baby's development. One of the first ways early on is to provide breast milk. It's associated with improved developmental outcome and decreased risk of infection. Another important thing that parents can do is read to your baby. We actually have a NICU library here. It's very important for your baby to hear your voice, and reading is also associated with improved language skills for your baby later on. We have our developmental follow-up clinic where they're evaluated by our developmental specialists, and they can help make recommendations to your pediatrician if your baby has any special needs. Question 3. If my baby goes to the NICU, am I able to breastfeed my baby? We know that breastfeeding can certainly be a challenge when your baby is here in the NICU, but we want to support you as much as possible because your milk is critically important for your baby. One of the ways that we'll help you early on is to have you start pumping very shortly after birth. We want to get your milk supply well established. We want you to be successful at providing breast milk for your baby. When babies are ready to start doing some breast or bottle feeding, we always initiate breastfeeding first because it is that important. We have lactation consultants who are here, and our nurses are also very skilled at assisting moms in breastfeeding. We also have an amazing milk preparation room, which is pretty much unique to the Sacramento area, where we have specially trained milk technicians, and when mom brings in breast milk, they will make sure that the milk is properly stored. They will also add additives, which are ordered by the physicians upon the recommendation of the dietitians if your baby needs help with their growth in any way. Question 4. Who will be taking care of my baby if my baby goes to the NICU? What kind of team do you have? When your baby's admitted to the NICU, you will meet a lot of different people. We have neonatologists, so specialists who take care of only babies, in-house at all times here at Mercy San Juan. We have neonatal nurse practitioners. We have specially trained nurses and respiratory therapists who are here at all times. We have neonatal dietitians. We have neonatal pharmacists. We have the lactation consultants. One of the benefits, I think, of our program is that parents will hear from either the physician or the nurse practitioner every day to give them an update on their baby. Question 5. If I don't deliver at Mercy San Juan, can my baby still get NICU care? If you do happen to deliver at an outlying hospital that doesn't have NICU care, we can help with that. Your pediatrician can call us just for advice or can call and request a transfer. If that happens, we actually will try to get there before the delivery if we can, so that our specially trained team is there to provide support for your baby early on. During transport, your baby will be cared for in a special isolette that is geared to provide whatever equipment and support your baby needs. We have a designated transport team. We have a designated ambulance here on campus so that if we receive that call from your pediatrician, we're able to get on the road and get to your baby as soon as possible. Once the team arrives, they will stabilize your baby and then transport the baby here to Mercy San Juan. Once we get your baby tucked in, you can rest assured that the neonatologist will give you a call to give you an update on your baby and let you know what the plan of care is for your baby. If mom is at an outlying hospital that's a Dignity hospital, mom can also utilize our robot system and beam in and see her baby at any time. We know that having a baby in the NICU can be a very stressful time. We are all here to not only take great care of your baby, but also to take care of you.